Hi, my name is Claudette Hampton. I'm concerned about health care and health care reform. Having worked all of my adult life, always having health care, you can imagine how I felt 2 years ago when I lost my job. I lost my health care. I lived for a year on my personal savings. I've exhausted all of that. I now am employed. Very nice job, and I like it. They're providing health care, but it's health care I can't afford. I'm pretty much almost on a fixed income, working part-time. The job is offering to pay half of the insurance, but the monthly rate is over $400. So that would mean that I'd be spending maybe about $250 a month for health care, and my cost of living with the health care included, I couldn't afford. I don't know if I'll be able to hold on for the next 2.5, 3 years to make 65 to collect Medicare. I don't know. But right now I have health care needs, and I'm just hoping that the reform will come, and come soon. Thank you.
Hi, good afternoon. My name is Arnitha Price Moore, and I am a member of Third Baptist Church of Chicago, a member of the Health and Wellness Ministry. I also am an advocate for breast cancer awareness. My story is that my mother, who was at one point the president of the co-president of the healthcare ministry in Third Baptist Church of Chicago, prior to her passing, one of the things that bothered me was that when she was about to turn 71, her health care costs went up versus going down. And, that to me that seemed to be crazy, considering that she had health care coverage before. She had pre-existing conditions that when she went to get service for the, lung cancer that she developed, that there was things that they weren't willing to do because she had these pre-conditioned services. My father is now up in age, and he's facing the same thing with his health care. The cost of it is going up because his age has gone up, and it makes it hard for him to be able to get services because he too has pre-existing conditions. So I think the reform needs to be worked, especially for our senior citizens. Me myself, I'm okay as long as my parents were okay, and we need the health care reform.
My name is Dorothy Powell. I live in Chicago, Illinois, in Merrimack Park. I am retired. I've been retired 15 years, and my health has fallen since I have been retired, and I have more illnesses now than I used to have. And when I go to the doctor, everything is so much higher than they used to be. Some of these tests I'm afraid to take because I'll use up all my insurance money. The insurance is just very expensive, and the medications are outrageous in price. And I'm trying to deal with it, though it is very hard to deal with. Every time I go to the doctor, I have a new illness that I didn't know anything about. Right now, I'm having problems with my hand, and I'm trying to take some tests for my hand. And I found out that my insurance is not going to cover it. They don't think it's going to cover it. I would have to pay out of my pocket. And I don't have that type of money because I only receive a check once a month. And I would really like a better plan